through these. What do you call these two chambers? The upper two chambers?
Atrium.
Two
Left and
atrium.
right.
So you have left and right. Which is left, which is right?
This is left.
Left, right. Okay. And the two ventricles, left ventricle, right ventricle. Now the septum that separates the two ventricles is called interventricular septum. This is the interventricular septum. And what you see from the outside is a sulcus, not a septum. You see the sulcus from the outside. This sulcus is called interventricular sulcus. So there is the anterior interventricular artery and the great cardiac vein and anterior interventricular artery run in the anterior interventricular sulcus. Okay. What do you call this sulcus here? This sulcus. Atrioventricular groove. It's called atrioventricular groove. Between the two atria and the two ventricles, it's called atrioventricular groove or coronary sulcus. That's the coronary sulcus, where the coronary arteries run in it. So the left and right coronary arteries, they run in the coronary sulcus, also called atrioventricular groove, because it's at the junction between the two atria and the two ventricles. So you have coronary sulcus and you have anterior interventricular sulcus. From the back, I don't know if you can see it or not. Maybe this side we can go over it. In the back you have posterior interventricular sulcus. What artery and vein runs in the posterior interventricular sulcus? When you say posterior interventricular sulcus, then the artery would be called posterior interventricular artery. Immediately you know, you say posterior interventricular sulcus, you say posterior interventricular artery. If you say anterior interventricular sulcus, you say anterior interventricular artery runs in. The veins are having different names. The veins in the anterior sulcus is called cardiac vein. In the posterior sulcus, it's called middle cardiac vein. So here is called great cardiac vein in the anterior sulcus. In the posterior sulcus, it's called the middle cardiac vein. Okay. Then you have what's called this sulcus. See the sulcus here now? What do you call this sulcus? It goes all around the heart. This sulcus. You can see it here, you can see it below this atrium. This is the auricle of left atrium. This is the right atrium here. And the sulcus is covered sometimes by the auricle. But the sulcus is there. You can see the sulcus. It runs all over. It circulates the heart. It's between the two atria and the two ventricles. What do you call this sulcus? Coronary sulcus. We just did it on that model. Coronary sulcus. Or it has another name. Atrioventricular sulcus. Sorry, atrioventricular groove. Or coronary sulcus. You see the coronary arteries? Coronary arteries run in that sulcus. You see the red ones are coronary arteries. They run in the sulcus. You have left coronary artery. The left coronary artery is here. And the right coronary artery is here. They run in this sulcus. From the back, you have the coronary sinus. This blue one is the coronary sinus, which is a large vein that open in the right atrium. This is the right atrium here inside. So, which opening is this? For which vein? This is an opening of a vein. Which vein? Goes in here. This is the right atrium. Right atrium. What vein is this one?
Pulmonary? No.
No, but the coronary sulcus is, the coronary sinus is here, it's open here. Which veins goes into the right atrium? You think about the veins that open in the right atrium. What is this?
Inferior.
Vena cava. That's the inferior vena cava. And where is the superior vena cava? Can you show me the superior vena cava? Where is it? This one? Yes. This superior vena cava is here. Inferior vena cava is there. Now, where is the pulmonary trunk? Pulmonary trunk. Who can show me the pulmonary trunk? Can, yes, this is pulmonary trunk. And where is the aorta? Aorta is the red one, right? Now, this is the aortic arch. See the aortic arch? And I will not go through these vessels because these vessels will be covered in chapter 19. We will not do the vessels, okay? But you should know the pulmonary trunk, you should know the aorta, you should know the two vena cavas, one superior, one inferior. You should know the coronary sulcus, coronary sinus, that's the sinus, it's a vein. And the coronary sulcus, of course, but the coronary sinus is a vein. And then you have 4 veins here. Can you see these 4 red veins?
Yes.
What do you call them? Yeah, pulmonary veins. They open where? They open which chamber? In which chamber? In the left atrium. They open in the left atrium. Okay. So you can see 2. They come 2 from each lung. These 2 are coming from the left lung. These 2 are coming from the right lung. All of them open in the left atrium. They bring oxygen to the blood.
So the right atrium is the non-oxygenated blood?
Yes, right atrium non-oxygenated. Look, 2 vena cavas and the coronary sinus, all of them deoxygenated the blood and they open in the right atrium. While oxygenated blood, it drains into the left atrium. So if you remove, this is the cover of the right atrium. If you remove it, then you will see the inside. Can you open? You have to pull it, I think.